Hi, welcome to my YouTube channel. Hope all of you are doing well. Today, for the benefit of those who are watching my YouTube channel whose first language is not Sinhalese, I thought I should do this video in English because this is something that was requested by many of you, and it's something that is important, something that you should be working on once you come to Canada. So today I'm going to tell you about finding your family physician in Canada and how to find your family physician in Canada. So before I begin, I want to sort of reiterate the fact that this is based entirely on my personal experiences, and this is how I proceeded with it. Depending on where you live, in which province you live, your experiences may vary, and sometimes even depending on which region you live, the process might not be this. It might be more complicated or it might be less complicated. So this is entirely how we have been looking for a family physician, how the process was for us. In Canada, the system for finding a doctor is a little different from what we are used to in Sri Lanka. So back at home, whenever we want a doctor, what we would do is based on what kind of illness we have, we would usually sort of decide, okay, this is it. It's time for me to go to an ENT now. It's time for me to go and meet a gynecologist. It's time for me to go and meet some other specialist. So we decide who to see, and we usually book a channel with a channeling with a physician. So and usually we pick a specialist in the area and we decide which specialist to go to. But in Canada, the system is different. So all of us, anyone who would need any medical intervention, we would first go to a physician. So a general physician, and here there is a system called the family doctor system. So once you come to Canada, your family would need a doctor, a physician, a general physician, who would be looking after your health in general. So your whole family would be registered under him, and even when you go to the hospital for an emergency, the first thing that they would ask for is who is your family doctor, so that a copy of whatever the treatments that you were given would be sort of notified to your family doctor. So the family doctor is kept on the loop. So the whole medical history would be with the family doctor. The family doctor would know what kind of medication was given, which specialists you were referred to, what kind of, if you have had an emergency, what kind of emergency treatments were given. So all of this, he or she is kept in the loop. So it's very important that you find a family physician, because you can't actually book a specialist in Canada. It's the family physician who would have a look at you and give you your first medication, and then would decide if it is above their level of treatment, and would decide whether you need any specialist intervention, and it would be through their office that you will be referred to a specialist. So for example, when I was pregnant, I had gestational diabetes. The usual practice for a pregnancy here is for your family doctor to take care of you until you're 20 weeks into your pregnancy, and then only she would refer you to an OB. Here you would be referred to an OB. And but however, since I had gestational diabetes, she had to sort of refer me to an endocrinologist. So it was her office that referred me. They looked for the doctor, they sent in the referral, and then the endocrinologist called me to say, look, I've been referred, you have been referred to me, So, your doctor's office contacted me, and then the endocrinologist secretary would set up an appointment with me for that particular ailment. So that is how it would work. Um, and it is always the family doctor who would make the call of referring you to the relevant specialist if you have any medical problems. So the first thing that you would want to do once you come to Canada and have received your health card is to find a family doctor. Now this becomes a little complicated depending on where you live, because most of the practices in around Toronto are actually most of them are pretty full, so they don't accept new patients. So you will have to call a few places. So the easiest way for you to do it is do a simple Google search for physicians in general physicians around me, or family doctors around me, and then call each and every office. So it is a bit of a manual process, and it is time consuming, but you will have to do it, I mean, if you really want a doctor. So you'll have to keep on calling each of these offices and ask whether they accept new patients, and whether you can register yourself with them. So once you find someone who is willing to take you in, you just have to give your health card number and your basic details, and they would register you under them. So after that, it's not a big process. So finding your doctor is the more complicated process. However, if you do not have a family doctor for now, what you can do is you can actually go for any of the walk-in clinics. So most of the general physicians, they do accept walk-in patients. That means you just call them ahead and make an appointment. Sometimes this is due to COVID, so you have to sometimes call them and say, look, I'm coming, and just give your name and details, so that because they might be looking at only a limited number of patients for a given day. Some of the doctors don't even accept walk-ins in the current situation. So you'll have to just give them a call ahead. Otherwise, usually a walk-in would mean that you just walk in and ask whether the doctor is available and wait for the doctor to have a look at you. So depending on their schedule and depending on how busy they are, you'd be waiting there for a few minutes to maybe an hour, and then they would have a look at you and would treat you. So I mean, they do accept walk-ins, but these doctors, I mean, they're not your family doctor. They just, for that particular point of time, if you're not feeling well, they will just come and sort of take care of it. It's not like, they would follow up with you the way a family doctor would. So you can go for a walk-in. Supposing you don't have your, let's say you don't have a health card and you can't go to a doctor right now, there's also the service called telehealth. So you have telehealth numbers in every region, all across Canada. You can just call telehealth and tell them your symptoms. Usually it's a registered nurse who would be answering your calls. So they tell you, I mean, I've called them several times during my pregnancy. So they would just, speak to you. If they're too busy, they would say, okay, we will call you back in, let's say 20 to 30 minutes, and then they would call you. And they do offer advice. They do tell you, what to do, but of course, there's only certain things that you can do over the phone. So it depends on, what kind of an ailment you have, how terribly you are feeling. So their advice is, if you feel terrible, if you have severe pains, or if you feel that this is a medical emergency, don't wait for them. Just go to the nearest ER. If it is something like an accident, you can just call 911 and let the ambulance, the paramedics take you to the ER. So telehealth is most of the time for small things for which you can just do away with medical advice. But of course, these avenues are also available until you find your family doctor. So once you find your family doctor, the family doctor would decide what kind of intervention you would need and would give you the necessary, they would give you necessary treatments, or they would refer you to someone who is a specialist in the field. Usually if you have kids, the vaccinations are done by the family doctor. Now most of the parents who would be coming from Sri Lanka have this question whether you can have a pediatrician for your kid, because we are used to that. I mean, we would just go ahead and go to our favorite pediatrician and would get all the medication and all treatments done by the pediatrician for our children. So everyone would have that problem, whether can we have a pediatrician. So usually the practice is for your family doctor to look after your kid. That is the usual practice. However, when a baby is born, the hospital asks whether you want to be referred to a pediatrician, so that the hospital can straight away refer you to the relevant pediatrician. So for my younger daughter, that happened, especially because she was a premature baby. Her neonatal pediatrician who was treating her, he was willing to take her in, so we just had to, the hospital could transfer her to the relevant pediatrician. If not, pediatricians can't straight away accept you. So no specialist can straight away accept you as a walk-in patient. You can't just decide to go to a specialist. So even pediatricians fall into that category. So just because you call a pediatrician's office, they wouldn't accept you. The way to do it is you have to go to a general physician, be it your family doctor or someone from a walk-in clinic. You can even go to a walk-in clinic and get referred. So you can just tell that this you want a referral to a certain pediatrician. You give their contact details, and then they would give you a referral, and they would refer you to the relevant pediatrician, and then the pediatrician can accept you. So how it would work is you would have to find a pediatrician first, and then call them and see whether they are willing to take in new patients. And if they say that they are willing to take in new patients and they have space to sort of accommodate new patient, you just have to take their details, like the pediatrician name and contact details. And then if you have a family doctor, you can straight away ask your family doctor to give a referral. So for my older daughter, that's what we did. We have a family doctor. So when I was in Brampton, I had a family doctor. So I just spoke to her. I just gave her a call and said, I want to be referred to a pediatrician in Richmond Hill. So I gave her the details of an available pediatrician, and she would just do a referral and send it across with my daughter's details. And then the pediatrician, I'm yet to hear from the pediatrician's office, so they would call us within a few weeks probably, and would confirm that they can register my daughter as a patient. So that is how it would work. They can't just straight away accept. So you will have to go to a walk-in clinic, or you have to go to your family physician, and you'll have to get the referral, the necessary referral for the pediatrician. So it's not that it is impossible, it's just that it's not done the same way. So you'll have to sort of be referred by a general physician for the pediatric services. So these are the, all of this is based on my experiences. So I spent a fair amount of time looking for a family doctor. It has been difficult. When I was in Brampton, I luckily found a doctor. She was Sri Lankan, so and she had space luckily at the time when I called. So it was easier for me to get registered with them. But now I'm facing that difficulty again, because there's a scarcity of general physicians, family doctors in Richmond Hill. So whoever, some of my friends have been referring me to their family doctor, saying, this doctor is particularly good, you should give them a call. But then when I give them a call, usually they say, oh, we are not accepting new patients. So I have been having that difficulty while I'm here. So I'm still in the lookout for a family doctor. So the trick is for you to keep calling and see if someone is willing to accept, and then you can get registered under them. it's something that you should be doing very early on, especially if you have small children, because you know, the vaccinations come up, you need to make sure that they're okay. So you would want to sort of, you know, check on them regularly. So it's better that you pick and you know, finalize a family physician. It's really helpful for you to actually do a Google search on them and read reviews. Reviews are very important here. Your Google reviews, I mean, most of the patients keep Google reviews for their physicians, so you can just have a look and decide for yourself whether you like that particular doctor or not. And if they haven't done a good job, they would definitely let you know on Google reviews that they're not satisfied with the service. So it's very I mean, it's very resourceful. You can just read up a little bit about them, and then I mean, you can decide whether to go ahead with that particular doctor or not. So I hope I have clear, I mean, you have, if you had any questions or doubts, that I was able to clarify it. If there are any other questions regarding this, you can just leave a comment below and I would respond to you. Thank you very much. So I hope those who have been requesting videos done in English would find this useful. Thank you again for your continued support, and I'll meet you again with another video. Until then, have a good day.